Treatment choice for diabetic macular edema. Diabetic macular edema is manifested as retinal thickening caused by the accumulation of intraretinal fluid, primarily in the inner and outer plexiform layers. It is believed to be a result of hyperpermeability of the retinal vasculature. DME can be presented with any level of diabetic retinopathy.
The human eye is a complex organ that provides one of our most treasured senses, sight. At the back of the eye is a region called the macula, which is a specialized area of the retina that is responsible for central vision. The center of this region is known as the fovea. The retina is the light-sensitive inner lining of the eye, which contains nerves, blood vessels, and photoreceptor cells referred to as rods and cones. Diabetic macular edema, or DME, occurs as a result of increased vascular permeability, which promotes the accumulation of fluid and protein deposits in the macular region of the retina. This causes retinal swelling and damage, leading to visual impairment. The VEGF-A is a protein which promotes vascular permeability via the activation of its receptor found on the surface of endothelial cells. In DME, elevated VEGF levels increase vascular permeability by loosening the tight junctions between endothelial cells in the walls of the capillaries. As the junctions loosen, the intravascular fluid leaks out into the surrounding tissues of the retina. Increased vascular permeability promotes the formation of macular edema and the deposits of hard exudates, both of which disrupt the morphology of the retina and may lead to visual impairment. Patients suffering from visual impairment due to DME may experience blurred central vision. Ranibizumab, known as Lucentis, is a humanized monoclonal antibody fragment that binds to and inhibits multiple isoforms of VEGF-A. Inhibition of VEGF-A signaling strengthens tight junctions, which reduce vascular leakage. A decrease in vascular permeability diminishes the formation of macular edema, which can lead to visual impairment and diabetes. Treatment of macular edema may alleviate the visual impairment associated with DME.
The applications in medicine. How to diagnose it.
The comprehensive dilated eye exam. Opening the door to preventing blindness. A doctor can detect signs of diabetic retinopathy during a comprehensive dilated eye exam. The patient receives special eye drops that dilate the pupils. The pupils open wide, allowing the doctor to see the back of the eye clearly. When eyes are dilated, the doctor can clearly see the retina, optic nerve, and the macula. Early diabetic retinopathy starts with small red dots called microaneurysms and can progress to leaking blood vessels, causing thickening of the retina and blurring of vision, or new blood vessel growth that can bleed and cause blindness. If you have diabetes, you are at risk for diabetic retinopathy. Dilation enables doctors to get a better view of the back of the eye, which allows them to determine whether there are early symptoms of disease. But it's important to know that all people older than 60 need a comprehensive dilated eye exam each year and should inform their doctor right away if they begin to have problems with their sight. People at higher risk may need to have a dilated eye exam more often. Risk factors, including race, age, and family history, are all important to determine how often patients should receive a comprehensive dilated eye exam. To learn more about
The warnings. Diabetic macular edema is a leading cause of visual impairment in people with diabetes mellitus, and if left untreated, more than 50% of patients lose more than 2 lines of visual acuity within 2 years. DME mostly affects the working-age population, imposing a significant burden both on society and on individual patients, a burden that is expected to increase with the rising prevalence of diabetes. The treatment techniques. The standard therapy for visual impairment due to DME, focal and/or grid laser photocoagulation is mostly only able to stabilize vision. The pharmacological therapy focus on targeting vascular endothelial growth factor, like ranibizumab.
To prepare for your medication injection, your ophthalmologist will clean your eye to prevent infection and numb your eye with anesthesia to reduce discomfort during the injection. Your pupils may be dilated or widened with dilating eye drops. The anti-VEGF medication is injected into the vitreous or jelly-like substance in the center of the eye. You may feel pressure in your eye when the medication is injected. Your ophthalmologist will also perform laser surgery to help reduce swelling of the macula. An anesthetic is used to numb your eye, and a special contact lens is placed on your eye to help keep the eye from moving and to focus the laser. It is important to keep your eyes as still as possible during the treatment. The procedure takes about 15 minutes. With focal laser treatment for macular edema, a laser is aimed at specific areas on the retina to seal off leaking blood vessels. The laser is not focused directly on the center of the macula, since this would affect your central vision. The goal is to reduce blood vessel leakage around the macula to help reduce swelling and slow vision loss.
Diabetic retinopathy is the most common cause of permanent vision loss among working-age individuals in the United States. Currently, there are excellent treatment options available either commercially or in research trials. The DRCR, or the Diabetic Retinopathy Clinical Research Network, is a group of retina specialists that are actively studying this disease in research trials, and they are working towards finding the newest and best treatments for blinding complications of diabetes in the eye. Several new imaging methods can non-invasively and quickly detect retinal problems early in patients with diabetic retinopathy. Office-based laser procedures are commercially available now and have been shown to reduce retinal swelling and block the progression of blood vessels that can cause complications in diabetics. There are exciting new injectable medications that block VEGF, which is vascular endothelial growth factor, which is the molecule that leads to complications in the retina in diabetics. Currently, the commercially available agents include bevacizumab or Avastin, ranibizumab or Lucentis, and aflibercept or Eylea. These medications have excellent success rates for the treatment of diabetic retinopathy and have saved vision in a lot of patients. Other experimental molecules are being tested in clinical studies. These are newer steroid-based implants that can last a long time in the eye, and they can maintain vision in diabetics. One of these implants can actually last for 3 years in the eye. If you want to learn more about these exciting new treatments, make sure you schedule an appointment with your local eye care professional today.
The pros and cons. The pros. Clinical studies have consistently demonstrated a favorable safety and tolerability profile with ranibizumab in patients with DME, with no imbalances in the rates of serious adverse events, no indications of an increased rate of cardiovascular or cerebrovascular events. The cons. There is a low incidence of endophthalmitis in ranibizumab treatment arms. This issue applied in Ecuador. In Ecuador, diabetes is affecting the population with increasing rates according to the Ensanud survey. The prevalence of diabetes in the population aged 10 to 59 years is 1.7%. Diabetic macular edema is more frequent in older adults. The conclusion. Sometimes there is nothing you can do to prevent diabetic retinopathy or DME, but your best chance at avoiding them comes by maintaining a healthy lifestyle, exercising regularly, eating lots of vegetables and fruit, and visiting your eye doctor at least once a year to stay on top of your eye health.
We explain diabetic macular edema. Meet Joe. Joe was diagnosed with diabetes 3 years ago. Since then, he's had to make changes to his lifestyle. Joe has been bombarded with information about the ways his diabetes could affect other aspects of his health. There are literally hundreds of sources, from leaflets at the clinic and hospital to entire websites devoted to the issue. Joe can't possibly read everything and finds all the advice overwhelming. Due to this information overload, Joe has missed some important stuff. He may not even know that he could suffer vision deterioration or even loss if he does not manage his diabetes properly. Vision impairment due to diabetic macular edema, or DME for short, is one of the leading causes of blindness in those suffering from diabetes. DME is a consequence of diabetic retinopathy, the most common diabetic eye complication. DME can lead to significant visual impairment in up to 3% of patients with diabetes. Sight loss is the most feared diabetes-related complication. DME occurs when tiny blood vessels in the eye begin to leak fluid. This fluid causes swelling in the central portion of the retina, or macula, which makes vision blurry. Sufferers may also experience image distortion, color or contrast changes, floaters or dark spots in the field of vision, called scotomas. It's important to remember that these symptoms don't just happen overnight. It's a chronic condition that can take years to develop. For someone like Joe, visual impairment can hugely affect his everyday life, from managing his diabetic medications to preventing him from being able to drive or even work. And if left untreated, he could even lose his sight. Joe should visit his ophthalmologist on a regular basis. While there are treatments for visual impairment due to DME available, the best form of prevention for Joe is to manage his blood sugar levels carefully and effectively. Pay attention to other risk factors such as his diet and weight, and of course, take regular cardiovascular exercise. If Joe begins to experience any of the symptoms of visual impairment due to DME, a retinal specialist will be able to recommend the right treatment for him to ensure Joe retains a high vision-related quality of life.